There's not enough oversight in policing or public health in Ontario, according to the provincial ombudsman. Lisa Hefner has details of the report released today.
Ontario Ombudsman Paul Dube says his office received more than 20,000 complaints this past pandemic year.
For vulnerable people, like inmates in provincial jails, children and youth in care and custody, or Ontarians reliant on social benefits who are unable to reach their caseworkers, our staff's ability to connect them with the right person was particularly valuable.
His office helped municipalities transition to online meetings. And persistent inquiries from the Ombudsman helped people with complex medical needs move out of the hospital and into more appropriate care settings. The Ombudsman says the Ministry of Health will implement all its ambulance recommendations, an overhaul of the system to investigate complaints. And Dube says the long-term care ministry has also made significant improvements in oversight. But when complaints came in about local public health units, the Ombudsman found no way to resolve the problems.
It was 87 complaints related to COVID testing, contact tracing, mask and social distancing guidelines, closure of amenities, access to vaccines, that type of thing. So those are things that people wanted answers for from public health.
Public health is not accountable to an oversight body, so there was no one to address the complaints. And that's a problem, he says. Similarly, Dube was critical of police oversight in Ontario.
After a year of protests calling for police reform across North America, I have to note a regrettable lack of progress on my 2016 recommendations to improve police de-escalation training.
Halton Police Chief Stephen Tanner takes exception to that finding.
We've done a great deal of de-escalation training over the past few years. That's been probably the number one priority of our use of force training, is that we always want to de-escalate.
But he does agree with the Ombudsman that the current system of investigating complaints against police doesn't work.
The OIPRD deals with public complaints about police services or about police officers. They need to be funded and staffed sufficiently so they can actually investigate those complaints. Right now, a great large percentage of those complaints come right back to the police service where the complaint came from, and then we investigate it.
Tanner says there have been improvements in the speed of investigations by the other police oversight body, the SIU, called when anyone is seriously hurt in an interaction with police. The Ombudsman says a key recommendation was met when the Special Investigations Unit Act came into effect last December. Lisa Hefner, CHCH News.